Hello all. Welcome to the webinar on COVID-19 innovations, discussing about where we are and what's next. To give you an introduction to myself, I'm Sreevas, a lecturer at the Hunter Center for Entrepreneurship at Strathclyde Business School in Glasgow in the United Kingdom. My research focuses on entrepreneurship and innovation from emerging markets. And given this research interest, naturally, when innovations began to be developed for COVID-19 over the last 5-6 months, I was naturally sort of interested in knowing more about this, studying them in detail, and that forms the background to what will be the basis for today's discussion. And then towards the later half of the presentation, I'll also be looking at what's next given where we are in terms of these innovations. If you look at early warnings that we might have had for the COVID-19, it's definitely not January 2020 when we were told about a potential pandemic like this. There was early research as back as 2007 from China talking about horseshoe bats as a potential source of viruses like coronavirus. And more recently in 2015, Bill Gates had a talk where he mentioned how the world wasn't really prepared for an outbreak like the COVID-19 pandemic. And clearly, even in 2020, 5 years after this talk, we weren't really prepared for it. This then tells us that this necessity that is really pushing us into making these innovations and inventions for that matter. The agenda for today's talk is looking at 4 key aspects, starting off with 5 key enabling technologies for the innovations that we have had over the last 5-6 months, categorizing these innovations into 3 categories, looking into more depth about biomedical innovation process, and rounding it off by talking about what's next for the COVID-19 innovation agenda. If you start thinking about these enabling technologies, from this list, you can quite clearly make out the fact that had COVID hit us even 2 decades back, which is, let's say, early 2000s, we really did not have any of these technologies at the shape and form that we have them today to really be supporting us with these innovations. There was no additive manufacturing, robotics, and AI wasn't developed to the extent that we have it today. Internet facilities weren't that good for crowdsourcing to be thought of in the scale that is being thought of today, and we didn't have big data analysis skills to support these. So though these are key enabling technologies for today, 2 decades back, we might have found it a lot more difficult to handle the pattern. Now that we have these, let's look at how these technologies have been supporting us. With regard to additive manufacturing, we are talking about 3D printing predominantly, which has helped us creating face masks, nasal swabs, and at a large scale at which we want them now for handling the COVID pandemic. Looking at robotics, we have startups like Asimo Robotics, which have developed bots called the Karmi bot, which are being used at entrances to public spaces, also in hospital isolation wards to help with medical staff, social distancing, all these different requirements of COVID. The Spot robot from Boston Dynamics is helping a lot of frontline medical staff, similar to the Karmi bot, in settings like parking lots and tents where they are doing testing for COVID, and this bot is helping them with things like that. An IAMK incubated startup has developed a robotic arm which is helping with taking swabs without human contact, which is helping medical staff and protecting them from direct contact with potential patients. Crowdsourcing is another area which has been helping us a lot. If you look at IEEE Kerala section specifically, they have had a history of using crowdsourcing for similar emergencies. Specific case and example being KeralaRescue.in, which was used during Kerala floods for coordinating flood relief, rescue, and rehabilitation. Those ideas are now being used in the COVID situation as well with crowdsourced innovations like Corona Safe Network, which is an open source public utility that is bringing together innovators, volunteers, educational institutions, government into a single portal to provide innovations for COVID. Break Corona is another example, which is being started by the Kerala State Startup Mission, which allows a lot of innovators to come up and post ideas and then collaborate to bring up innovations for the COVID situation. Machine learning, artificial intelligence is another area which is really helping us a lot. Blue Dot is a startup which has developed a system that is helping with warning systems for infectious diseases. And in fact, they came up with the first scientific paper on COVID-19, which was predicting the potential spread of this virus across different countries, which has been helpful with modeling for healthcare infrastructure and things like that. Another for a machine learning startup product is C19 Index, which is developed by closed loop AI. This provides like a artificial intelligence based predictive model that helps to identify the vulnerability index of potential people with the COVID virus. And similar examples are also there with open research data sets like the one that's been provided by the Allen Institute for AI, which is helping a lot of researchers to open source use natural language processing and such AI methods to predict and look at COVID infections and their disease spreads and all of those things. Talking about big data, again, combined with AI is helping us a lot. The Johns Hopkins Institute has this dashboard where they have a heat map of where the infection spreads are, what are the infection rates. All these things are really helping us with looking at how does the infection spread and how does the health infrastructure need to respond with the infection spread. A homegrown app, the Arogya Setu, which is being promoted by the central government in India, is again using similar AI big data methods, pulling in information from Bluetooth and GPS to help know COVID infection spread, identify COVID patients, and identify vulnerable hotspots for COVID. Thanks to these enabling technologies, India has seen quite a wave of coronavirus innovations. And for me, when I was looking at this in more detail in my research, I noticed two key factors really pushing these innovations. So one was the fact that we were seeing universities, industries, and governments coming together and jointly co-creating innovations for the COVID virus. It was pushed largely by the fact that this was an emergency and we need immediate solutions. And this brought all these three sets of agents together to innovate for this. Second key thing which I noticed is the fact that there were a lot of intermediary organizations which were helping the coming together of universities, governments, and students and startups. One is startup incubators like Kerala Startup Mission and others. Second, we also saw the Department of Science and Technology and FICCI and all of those industry bodies also helping these three agents come together for these innovations. If you look at Kerala's case in specific, what I said in the last slide holds good for Kerala as well. But what's additionally more interesting in the Kerala's case of approaching innovations is the sort of more personal or social approach to it. Let me give you an example. If you look at contact tracing, for instance, the way Kerala is approaching contact tracing is not just an Arogya Setu approach, which is a purely technology-based approach. Rather, in Kerala, we have ASHA workers, health staff, police staff, who are actually going and individually visiting the homes of potential people who are infected or are under quarantine, and then tracking their details and then ensuring that they are maintaining home quarantine and all of that. So though technology is used at the higher level with regard to making heat maps and dynamic Excel sheets, at the ground level, it's a clearly personal approach which has been helping in the sort of Kerala's fight in the COVID space. Thanks to the three innovations, the five enabling technologies that we discussed earlier on, we are seeing three categories of innovations really emerging within the Indian space and also the global space for that matter. The category which is of most importance for today's webinar is the first category, which is talking about biomedical and healthcare innovations. In addition, we are also seeing innovations to support the government, innovations that are around new products and services for a COVID world, for instance. The articles that I shared with you in the previous slides will have more details on the second and the third category. For today's webinar, we are going to look more deep at the first category of the innovation. If you look at biomedical and healthcare innovations, to a large extent, we can stage them into four categories around care management, for instance. So first category would be prevention, which is looking at decontamination of people. And in that, one innovation is developed by the Sreevas Sahasranamam Institute of Medical Sciences and Technology from Kerala, where they have developed something called a Chitra disinfection gateway. What it does is that it uses hydrogen peroxide and UV light to disinfect people who are kind of going through this gateway over a period of 40 seconds. So this is being used and sort of under testing, and it's going to be used at public entrances to spaces, so that people kind of go through this can be decontaminated of potential virus sources from their cloth and hand, for instance. But then it's not a cure for the virus per se, it just decontaminates it off surfaces. Another similar innovation comes from NPOL, which is the Naval Physical and Oceanographic Laboratory in Kochi, where they have created a UV-based disinfectant equipment that is being used in airports. In fact, in the Kochi airport, they are using this to disinfect luggage bags from the airlines. Another prevention equipment is the TMC shields, or the face shields, which you could develop through 3D printing machines, as I kind of discussed earlier on. But then in Kerala, we are seeing Kudumbashri, which is a women empowerment initiative. Women are making these face shields by hand, which is also a key preventive equipment that is helping us. Second category of innovations is in the sort of no-touch social distancing category, for instance. KarmiBot, we already discussed earlier on. The other innovations involve things like a keychain tool, which is developed by this interesting startup called Safeguard. If you look at the picture closely, you can see that it's not very high-tech innovation per se. It's just a plastic tool of sorts, but then it can be used on surfaces like car doors to open the car door. It could be used at ATM machines or point of sale machines in shops to enter your PIN number, things like this, so that you don't touch the surface by your hands, and thereby you are not becoming a potential carrier of the virus. Another similar low-tech but high-impact innovation is what's in the last picture, which is the leg-operated water taps, which is developed by a NIT Calicut startup. It's basically like a pedaled water dispensing machine. So again, low-tech but high-impact, so that you don't have a contact with the surface. Telemedicine and healthcare at home has been there for a while. It's just that the COVID situation has accelerated their potential impact and scale, with startups like Practo and Clinic app really filling in the gap for these innovations. Third category of innovations come in with regard to detection and testing. We have swab collection related innovations. One is a manual one, which was developed by the Government Engineering College in Wayanad, which is the walk-in sample kiosk. Then we also have the IIM incubated robotic arm swab collection. So these are swab collection based innovations. And then we have testing innovations. And one example is the Sreevas Sahasranamam Institute of Medical Sciences Gene Lab, which is now being commercialized, now under approval, and then planned to be commercialized through the startup called Agape Diagnostics, which is based out of Kochi. Another interesting innovation is by Cure AI. They already had an app that was doing X-ray detections, and now they have added an additional feature where they help us with doing chest X-ray detections, and thereby potentially identifying if there is a COVID patient, if the X-ray shows the indication of a COVID possibility, for instance. So that's again an interesting innovation that's helping us with detection and testing. Final category is with advanced care. And in this category, we have things like artificial manual breathing unit. The interesting element about this is that we had these ventilators in the past, but then given the nature of the COVID situation, we wanted innovations where it could be manually operated without a bystander or an additional person being in close contact with the patient and then needing to operate it. So that's the interesting element with the artificial manual breathing unit innovation. Another similar one is the Jeevan light. And the interesting element about this ventilator is the low cost, portable, low energy requirement aspect, which makes it ideal for employing these innovations in rural areas of India. Now, talking in general about how the innovation process for a biomedical product looks like, this is a flowchart that kind of tells you how an innovation life cycle for a biomedical product will look like. With the right hand side, I mean, as you go towards the right, it's actually more costly parts of the innovation process. So the initial steps involve ideation and prototyping of the product. Then it's about bench testing, animal testing, and human testing. And the final stage is about clinical trials and launching the product. And at the clinical trial stage is when you want approvals from, in the US scenario, it's the FDA, and there's European certifications like CE. And given the COVID situation, even ICMR, which is the Indian Council for Medical Research, is also sort of having an approval process, for instance. So this is how a usual product innovation in the biomedical space will look like. But we are definitely not talking about an usual time in the COVID case. We are talking about an emergency situation where we need a lot of these products to come at a really fast pace. And when we're talking about this, we need to talk about 4 characteristics of what is different about this context. First difference is the fact that government becomes a key stakeholder when it comes to doing innovations during emergencies, because it's a public health crisis that we are really dealing about. And what's unique about dealing with the government? It's the fact that biomedical innovators and engineers like you cannot just be working in the silo of a lab of with other biomedical engineers, or at least people who know engineering to some extent. We are going to be needing to talk with government staff, bureaucrats, and people who might not have that much of a technological expertise. So you need to have communication capability to convey your ideas in such a way that a multidisciplinary crowd can get the information that you need. A related point is the fact that you will also need to work with multidisciplinary teams. So it will no longer be a silo of a biomedical group of people. It will have to be working with teams which involves like IT professional, government staff. It might even require people like me, like who are in the economics or management space, to look at the products from a multidisciplinary outlook, because you are not just innovating from a health point, you are also looking at it from a public policy and the health emergency point of view, which requires multidisciplinary teams. The last 2 points are related in the sense that emergencies require innovations to happen at a rapid pace. And because they need to happen at a rapid pace, it also needs that there is a possibility for dynamically ideating and iterating the product. Let me give you an example. A typical biomedical innovation process it kind of usually goes through, like, say, a 6-7 months of initial prototyping, then kind of goes through another year or so of testing, and then it goes to a commercial launch and technology commercialization, which might take mass manufacturing in like 2 years or something. But given the COVID case, we cannot afford a 2-year, 3-year lag in the innovation coming into the market. Rather, we want it in like a month or like 6 months or something. So, which means we need to dynamically be able to process in new information, which will come in over the course, and use that to dynamically iterate the products, and also rapidly scale up the product so that we have the product in large scale within, let's say, a 6-month period, for instance. So that is what is unique about innovating during emergencies. Given that we know where we are now, let's look at what is needed in the Indian context with regard to taking forward these innovations. Where we are is at the prototype stage largely, and even in this stage, we need more of our university labs to step in. Some research labs like SET have been able to create these prototypes, but then our university labs are nowhere near in terms of technology expertise as well as human capital expertise to create these products. We need a lot more of this coming into our system, and biomedical engineers and students like you need to be the driving agents with regard to building this capacity for us. Second, if we look at the next stage, a key component to doing a lot of this testing and creating more of the products is with regard to finance. And what we have now is largely funds from the Department of Science and Technology, which is a government institution, which is giving in a lot of these funds for doing this testing. But then this cannot really be there at all times. So we need risk capital, which could be from angels and venture capitals and sources like that, which can really push us to the next frontier for commercializing more of these innovations, not just for COVID, also going forward within the Indian context. Third, if we look at it from the approval side, where do we get a lot of these approvals today? In India, a lot of these approvals are now going into the Drug and Pharma Authority. You might naturally ask me a puzzled question as to why is Drug and Pharma looking at product innovations? Clearly, that's two different ballparks, right? So in that regard, we need a product innovation specific regulation authority for India, which can look at it purely from the technology side of these products and regulate these products and kind of have approvals around that. So we need that also to help us with the commercialization aspects. And finally, when we look at it from the buyout and product launch point of view, again, we need a lot of you to really step up by creating startups which will take up the technologies that is coming up from the research labs, because research labs have the limitation where they are into research and prototyping. I mean, they do not have the bandwidth to commercialize these things, and startups need to come in to commercialize the technology that is coming out from our research labs. And we also need biomedical specific incubators to help support the startups that are going to commercialize, because India doesn't really have that much of expertise as a lot of the Western countries have with commercializing products for the medical innovation. So it's important that we also create the support system, create the startups to help the commercialization of technology. And here again, we need biomedical engineers, students, and then startups to really fill in the gap and build and bring in your specific expertise that you have built from your engineering and other sort of background to help us with these innovations. Another agenda for us going forward is that right at the university level, we need to have multidisciplinary teams working together on projects. What do I mean? Let me give you an example from what I am doing at Strathclyde Business School in the UK. So we have a course called Enterprise VIP. And what happens in this course is that we bring together engineers, business school students, humanities students, economics students, and put them in a joint team. And for the prototypes that are developed in the engineering departments, we get our business students to provide a business model or a commercialization technology plan and things like that. And we get the humanities students to think about from the customer's point of view, think about it from the social policy point of view and things like that. And so when we have these diverse multidisciplinary inputs coming into the project, it makes the output of the project more wholesome and also make it more ready for commercialization at a faster pace. Some of the examples is what I have put in this. There are in the last year we had projects like solar e-cookers and water desalination, solar-based product in Sundarbans Delta in West Bengal. So some examples, but then the important point is the multidisciplinary input that's coming into these projects. Then we also need, in the Indian context, a health innovation ecosystem transition. I'm not saying that we need one or the other, we need both, but then we need both to be of equal quality. What we already have is a good hub around vaccination and pharma and biotech, given companies like Biocon, Serum Institute, and all of them. And they have been pushing the Indian frontier from the vaccination point of view. And India is one of the largest exporters for a lot of these vaccines, as you might already know. And even Serum Institute is now hopefully going to be the lead exporter for the COVID-19 vaccine, if the vaccines that they are currently under testing is what is going to become the COVID vaccine, for instance. But then if we look at it from the medical product innovation point of view, we are still a net product importer. But we need to build our capacity on this front. And we are beginning to see good promising signs on this regard in the COVID situation. We are seeing startups like MyLab, we are seeing incubators like CCamp, and people like that coming together to create medical products. If we can build on this expertise that we are developing now around the COVID situation, we can become a local manufacturing hub for medical product innovations going forward. And biomedical engineers and innovators like you are going to be at the forefront of leading these innovations for us. So there again, we want you to take the charge and push us forward on this regard. Finally, there is a lot of scope for Indians to bring in their what I call frugal jugaad innovation approach and put it along with new and existing innovations that we have to create indigenous medical device innovations for the Indian context. Let me give you an example. If we look at the ventilator example that we discussed earlier, ventilators has been around for a while. So ventilators by itself is not a new innovation or like that. But then what's been new with that in the Indian context is the fact that we are customizing and contextualizing the innovation for the Indian context, especially the rural Indian context. So if you look at the aerobiosis ventilator, it's a low-cost ventilator. It is so it's affordable to the rural masses. It is portable, so you can carry it around to even the rural areas and things like that. And third, it works with battery-supported technology. So you can put in lithium-ion batteries to operate it, so that you can operate it in conditions where electricity services aren't really that great. So when we put these things in combination, we have an indigenized version of an existing technology, or it could also be new technology, which will really drive us with regard to pushing the boundaries for local innovations in the Indian context. We are seeing people like the sort of organizations like National Biomedical Research Indigenization Consortium really pushing forward a lot of these innovations. We also have the Makers Asylum bringing together innovators to create frugal innovations like this. We need a lot more of this. And again, people like you need to really push us with regard to these innovations. And once we have these innovations, we also have the possibility to reverse knowledge transfer, or what's also called reverse innovation, wherein the indigenized versions of this technology could easily be taken over to like say other emerging markets in Africa where similar constraints are there for these innovations. It could even be taken to developed markets like the Western world and given over there. So we need all of this really coming forward from innovators like this to push us with regard to all of this. So that brings us to the close of the presentation. Thank you so much for attending the webinar, and I look forward to your questions. Thank you so much.